My name is Paul Brucker, CEO, President, and founder of Eagleclaw Pharmaceuticals. First and foremost, let me congratulate you on your acceptance into the sales world of the pharmaceutical industry. The following will be a tutorial on our sales cycle. I am confident that through our interview process, you have what it takes to get the job done. Let this video be a guide to your future success as a pharmaceutical sales representative for Eagleclaw Pharmaceuticals.
The following diagram is our sales cycle. The first step to our sales cycle is preparation. The most important thing our sales force has to do is be well educated. Even though we have a wide range of products, we don't want our representatives to have the overwhelming burden of knowing the ins and outs of every single drug we offer. Instead, we require our reps to be an expert on one specific drug so they can make it their specialty. But they don't only have to know their product. Most importantly, they have to know their clients. Eagleclaw markets and sells to a very wide range of medical practices within their specified territory. Whether it be a large hospital or a small private practice, our company strives to provide our scientific breakthroughs to whoever can benefit from them. When researching your client, learning every last detail about them is crucial. When making an appointment, you must understand that physicians are one of the most busiest people in the world. They have very little time to meet with their patients, let alone us. Therefore, using the foot in the door technique is a great tactic to use when on the phone. Make a small request by asking for a 15-minute meeting. Then when the meeting with the doctor, you can pursue selling your product. When you arrive, make sure to greet the receptionist, give a firm handshake, and make sure to smile. The same goes for the doctor as well. Establishing a good professional impression is crucial in pushing the sales cycle forward. The second step to the sales cycle is needs identification. Before you start describing the benefits of your drug, it's essential to build trust with the physician. A great handshake and smile can only go so far. In this step of the process, the sales representative will ask about the doctor's practice, not about the company. Here, it's important to understand that this time isn't about you, but about the person across from you. They should be doing most of the talking. Part of the first process is not only to be able to answer any questions the physician might have, but having the ability to ask them the right ones. The types of questions you will ask will be gauged to make your potential client think about his short and long-term goals about their practice, and what steps they need to take in order to get them there. This is where your research comes in handy. Knowing how they will answer your questions will give you the important advantage in steering the conversation in your favor. By doing this, you will establish a relationship of trust where the liking effect will take over and will be interested in how Eagleclaw's services may benefit their own practice. The third step to the sales cycle is your pitch. Once you have gained the trust of the physician, it is time to give your sales pitch. At this point in the conversation, you've identified what steps they need to take in order to improve their practice. If you've done the first two steps correctly, one of their needs will line up with the benefits of your represented drug. At this point, you sell your drug. You will be trained to be able to perfectly articulate all the medical benefits, results of the clinical trials, and how it should be prescribed to the diagnosed patients. Again, to be able to properly complete this step, your preparation needs to be perfect. The doctor will more than likely bombard you with all sorts of questions about its effectiveness as a medication. It is up to you to be well educated enough to where you can answer any of their questions about the drug in a positive manner. If you can accomplish this, you will proceed to the final step. The fourth and final step to the sales cycle is your close. This may be the quickest step in the process, but its completion is of the utmost importance. The most important part about your job is your ability to get the doctor to sign on the dotted line. After you've answered any questions he's had, you will ask him to commit to prescribing the drug to his clients. If the sales cycle was completed correctly, they will be motivated to sign the contract. When leaving, make sure you go on a good note. Look him in the eye, shake his hand, and say, "I look forward to our future business together." Congratulations on your new client. Remember the sales cycle: preparation, needs identification, pitch, and close.
Thanks for watching, and I wish you the best of luck out in the field.